My name is Janet Coleman. I am a registered nurse and an assistant instructor at Lancaster General College of Nursing and Health Sciences in Lancaster, Pennsylvania. I am coming to you today to talk to you about reading EKG strips. This podcast and learning exercise is for the senior level nursing students, or newer nurses or non-cardiac nurses may find this learning exercise helpful. I'm going to briefly go over the learning objectives for this experience. First, the student and or nurse will be able to state at the end of this podcast the normal conduction of the electrical impulses through the heart. In addition, they will be able to correlate these electrical impulses, or the EKG waveform, to the cardiac physiology. So that would be the second one. The third one would be to be able to accurately measure the ventricular rate on a 6-second strip, or any strip for that matter, the PR interval, the QRS interval, and the QT interval. Interpret the rhythm strips and based on their measurement findings, recognize lethal dysrhythmias, and then describe the nurse's role in the case of a lethal dysrhythmia that results in a resuscitation effort.
All right, let's look at the EKG paper itself. Horizontally, each small box is 0.04 seconds in time. Each larger box is 0.2 seconds. Now we're going to look at the electrical interpretation of the heart on paper. You have the P wave, which is depicted here on this drawing, and that represents the atrial contraction. The QRS represents the ventricle, and the T wave represents the repolarization of the ventricle, getting back to baseline. This is a 3-second strip. It's one of the ways that we can measure rate on paper. If you look, there are 15 large squares in a 3-second strip. So there would be 30 large squares in a 6-second strip. 6 seconds are the typical length of time that we measure a strip, because you can count all the QRS complexes in a 6-second strip, times it by 10, and you have your beats per minute. Here's another quick way to estimate rate. Line up the first QRS with one of the dark lines where you see the start arrow, and then find the next one. Wherever it falls, you will be able to estimate the rate. Caution, you only can do this with regular rhythms. Irregular rhythms do not work with this method. Now we're going to look at the normal conduction of the heart, the impulses. Start in the SA node in the right atrium, go across the atrium to the AV node, which acts as a gatekeeper, goes down the bundle of his, divides to the right and left bundle branches that go out to the Purkinje fibers.
All right, now the next thing we're going to learn how to do is how to measure our PR, our QRS, and our QT intervals. Now, if you're a nursing student or a non-telemetry type nurse, you probably aren't going to have calipers, which are the little tool that you would use. But I'm going to show you an easy way that you don't have to have calipers. Take your alcohol pad. All good nurses have some of these in their buckets. And all you need to do is lay the edge at the beginning of where you want to measure. Take a pen, take a little hatch mark where you want to end that measurement, and then hold it up against your grid paper and count off the boxes, and that will tell you how long your interval is, and you're measuring horizontal length in this instance.
The next thing we're going to look at is how to measure intervals. First is the PR interval shown in the orange, which will be 0.2 or less. The QRS interval, which is in pink at the top, that should be 0.12 or less, or the QT interval, shown at the bottom in the blue, should be 0.4 or less. Anything longer than this indicates some sort of conduction delay.
The next thing I want to talk about are the three things that I recommend that you keep in mind when you look at EKG strips. First, what's the rate? Is the heart rate falling in the normal range, which is 60 beats per minute to 100 beats per minute? Next thing I recommend that you keep in mind is the rhythm. You need to analyze the rhythm. Is it regular, meaning that you can march out every QRS and there is equal intervals in between each one? Or is it irregular? The last thing, the third thing that I want you to keep in mind is, are all the parts there? Meaning, is there a P wave in front of every QRS and a T wave following every QRS? If there's not, then there's some sort of problem going on.
Alright, let's start looking at our strips. This is normal sinus rhythm. The rate is approximately 75, the rhythm is regular, and all the parts are present. Next is sinus Brady. The rate is approximately 20, the rhythm is regular, and all the parts are present. This is sinus tag. The rate is approximately 150, the rhythm is regular, and all the parts are present. This is sinus rhythm with a PAC, premature atrial contraction. You can see that it falls earlier than expected, but has a P wave, which tells us it's a PAC. Normal sinus again, but this time with a PVC, premature ventricular contraction. We know it's a PVC because it's very wide and there is no P wave. This next strip is what's called atrial fibrillation. The rate I'm unsure about. We'd have to look at a longer strip. The rhythm is irregular, and that's the classic sign. Regularly, irregular, and no P waves. This next strip is atrial flutter. You can see that there are many P waves before each QRS, and the sawtooth pattern is the hallmark of this rhythm. Next is supraventricular tachycardia. Very fast, rate is in the close to 200. The rhythm's regular, and all the parts are present. Now we get into the AV blocks. This is first degree AV block. You can see that the PR interval is very long, longer than 0.2 seconds. The next one is one of the type 2 AV blocks. This is also known as Winky Bach. If you look at the PR interval, it will get progressively longer to a point where it drops a QRS complex. This is another type of second degree block. Here you can see there's a P wave with almost every QRS, and then it just drops the QRS. But the P waves keep on marching on independently. This is third degree heart block, or complete heart block. Please notice that the P waves and the QRSs are completely dissociated from one another. This is a serious condition and usually requires a pacemaker to be put in. This is ventricular tachycardia. This is a very serious dysrhythmia and needs immediate treatment either with drugs or with defibrillation, depending on whether or not it's stable or unstable. This is ventricular fibrillation. This is a lethal dysrhythmia and requires immediate defibrillation. This is asystole, another lethal dysrhythmia, and the prognosis for this is very poor.
Alright, I've shown you some basic EKG strips, and I've given you the tips that I know of for a beginning nurse or a nursing student to at least begin the basics of interpreting EKGs. Now let's review what your role as a nursing student or as a bedside nurse would be during some of those lethal arrhythmias. So the first thing you would do if you found someone unconscious would be the ABCs. Start your BLS protocol, good compressions, manage the airway, and call code. You need someone to immediately start recording, grab the chart, and also have your secretary call the primary doctor for this particular patient. You need to be aware of whatever lab results were done that morning in case there are some electric light imbalances that might be related to what's going on. All right, I hope that's helpful, and I wish you all the best of luck in interpreting your EKGs.